on these territories, we acknowledge the harms and mistakes of the past, and we dedicate ourselves to move forward in partnership with Indigenous communities in a spirit of truth, reconciliation, and collaboration. I'm joined today by Dr. Verna Yiu, AHS President and CEO, Sean Chilton, AHS Vice President of People, Health Professions and Information Technology, and Dr. Braden Manns, AHS Associate Chief Medical Officer. Dr. Yiu will give some brief remarks and then we'll be happy to take questions. Dr. Yiu.
Great, thanks very much, Gary. So good afternoon to everyone. First and most importantly, I just want to take this opportunity to offer my sincere condolences to anyone who's lost a family member, a friend, a loved one during this pandemic. We have all been touched by this crisis in some way at a very personal level. And to those who have lost someone, know that we all grieve with you. I also want to take a moment to really convey my deep gratitude to everyone who works in the healthcare system and everyone at Alberta Health Services, especially those on the front lines. You have all done amazing things over the past 19 months. You have saved lives, improved lives, you've offered care and support to people during incredibly difficult moments, and you've put patients first and foremost at every turn. I know that this has been a particularly trying and difficult time. We are hopeful that we would not see a fourth wave, but as we can see from all the data, the Delta variant has hit us very hard. At Alberta Health Services, we are committed to providing a healthy and safe environment for our staff, patients, and the public. A culture that supports safety and health is critical to our ability to provide excellent, timely healthcare to all Albertans. Immunization against COVID-19 is the most effective means to prevent the spread of COVID-19, to prevent outbreaks, to preserve workforce capacity to support the healthcare system, and to protect our workers, patients, visitors, and others accessing AHS sites. We have seen the power of the vaccines and their ability to bend the curve, help bring case numbers down, and protect our most vulnerable. That is why we are taking the next important step of requiring all employees and applicable contracted service providers, including physicians, midwives, and other frontline healthcare workers, to be fully immunized for COVID-19 by October 31st of 2021. This necessary and important step is required to protect our patients, vulnerable and immunocompromised Albertans, and anyone who visits or works at our healthcare facilities. This new policy will apply to all Alberta Health Services, Alberta Precision Labs, Care West, Capital Care, and Covenant Health employees, members of the medical and midwifery staff, students and volunteers, and other persons acting on their behalf. Additional details respecting the specific compliance requirements for other contracted service providers, such as continuing care, will be communicated directly to those contracted service providers. This is a necessary measure to help protect our vital frontline healthcare teams and help us maintain a safe environment for all patients and clients. Healthcare workers have an ethical and professional responsibility to protect others. For many, that's the driving force behind why they do what they do. Vaccination is a tool to assist in meeting the standard. Evidence overwhelmingly confirms that being fully immunized mitigates potential harm to patients and healthcare workers. Unvaccinated physicians and staff are more likely to contract COVID-19, as well as being more likely to transmit the virus to patients, hospitals, visitors, and colleagues. This policy also aligns with AHS core values, including compassion and respect to those in our care and placing safety at the center of all of our decisions. We must also be accountable to Albertans, ensuring that we are doing all we can do to keeping people safe and well. Any AHS employee who is unable to be immunized due to a medical reason or for another protected ground under the Alberta Human Rights Act will be reasonably accommodated. If an employee refuses without a medical reason, we will do all we can do to provide that employee with information and education to encourage vaccination. The policy document will be finalized following a period of union and stakeholder consultations. This new policy strengthens work that AHS has done throughout the pandemic to keeping our hospitals and healthcare facilities safe, including mandatory use of PPE, daily symptom checks for all healthcare staff, visitor restrictions, infection prevention and control measures, and ongoing staff education. Immunization requirements for frontline healthcare workers are not new. For example, staff who have not been immunized against influenza may be reassigned to other areas or restricted from working. New employees of AHS are already required to submit proof of vaccination for other communicable diseases such as measles, hepatitis B, and others. We acknowledge that this policy may be concerning for some, and we are not alone in taking this step. Similar policies are in place at some healthcare facilities in Ontario, Manitoba, and BC. Mandatory COVID immunizations are supported by the Canadian Medical Association, the Canadian Nurses Association, and closer to home, the Alberta Medical Association. As healthcare workers, it has always been our responsibility to protect our patients and to look after one another. That's what this new policy does, and we believe it helps us fulfill our commitment to providing safe, timely care to those who need it, while helping build a wall around our healthcare facilities. While we are here to talk about the new policy, I also want to touch on capacity within our healthcare system. We have all heard concerns from many, many people about this, including some of our healthcare workers and physicians. We continue to experience significant capacity challenges at many of our hospitals and healthcare sites. Our hospitals, particularly in urban and regional areas, are very, very busy. This means that we are having to make some difficult but necessary decisions in order to ensure that we have hospital beds, ICU spaces, and frontline staff available to provide care to patients. This week, we have reduced the number of non-urgent surgeries being performed in Edmonton and in Grand Prairie, which enables us to free up both bed space and frontline staff to support high priority areas. We've also had to temporarily reduce bed numbers in some rural and urban healthcare facilities, due in large part to difficulties in finding available physicians and staff. We have taken similar steps during other waves of the pandemic. However, the impacts of this current wave are certainly being exacerbated by staffing challenges. This has been a very long pandemic. Physicians and staff have stepped up for 19 months and done incredible things, but they are understandably tired. We do have the ability to open additional ICU and acute care beds, and we are doing that as quickly as we can. The biggest challenge right now is staffing those beds appropriately. We will continue to do all that we can do to ensure that our healthcare system is there for anybody who needs it, but we need everybody's help. We strongly urge people to stay home when sick. Consider wearing a mask in indoor public spaces when you're unable to physically distance, in addition to continuing and practice good hand hygiene. And please, please, please get immunized as quickly as possible. Immunizations protect you, your loved ones, our communities, and they help protect our hospitals. Thank you, and we're happy to take questions. And Carrie, I'll pass it back to you.
Thank you, Dr. Yiu. Obviously, there's lots of people on the line here. So if you either wave or put a question into the chat section of the Zoom call, we'll try and get to as many questions as you can. Who would like to go first? Okay, James Keller.
Hey there, I hope you can hear me. I just question about the hospital capacity. Like, what is AHS projecting? I know there's this early warning system where you guys can sort of look ahead and see, based on like where we actually see hospitalization numbers going. And right now, do we expect the numbers to sort of surpass either of the two previous waves for either ICU or non-ICU?
Yeah, so James, thanks for that question. And I might pass over the question over to Dr. Mans, but just to say that we are continuing to use our early warning system scenarios. As you have heard, we have 3 different projections on that. And right now it seems to be tracking on the moderate to the high scenario for early warning system. It is only good for up to 2 weeks, 3 weeks at the most in terms of being able to predict out. And we are seeing that the numbers are going to continue to increase as they have been over the past 2 weeks. And Braden, maybe over to you for some additional comments.
Sure. So we continuously monitor this early warning system. And if we look back to mid-August, we were seeing about 44 people in the intensive care unit with COVID. We're seeing about 102 right now. We were seeing about 174 in hospital beds with COVID. We're seeing about 358 right now. So you can understand that we are concerned about the direction that we're heading, and we're taking all steps necessary to make sure we will have enough ICU beds and hospital beds as needed.
Thanks, James. James, do you have a follow-up?
Yeah, I mean, I know that there's some commentary about, the need for people to stay home when sick and all of that. I mean, do you foresee the need for any additional public health measures, whether it's, any kind of restrictions, masking, vaccine requirements, in addition to what we're announcing today, to actually bend the infections down to prevent hospitalizations from essentially just continuing on this upward trajectory unabated?
Yeah, so James, I think these are decisions that are for the Chief Medical Officer of Health and Government, and for them to answer. I mean, our responsibility within Alberta Health Services is to ensure that the healthcare system is there for people who need it, and that's what we're currently focused on.
Okay, thank you, James. Madeline Smith, please.
Hi there, can you hear me?
Yeah, we're good.
Perfect. I'm curious about the current status of contact tracing in Alberta. I know that when AHS sort of stepped back with contact tracing, I believe in July, there was talk that there was a plan to scale it back up if that was necessary. Given that cases are so much higher now, has that plan been put into effect?
Yeah, so Madeline, I would say that for contact tracing, we have again been monitoring our numbers, and our contact tracing, we have not continued to ramp down any further right now. We are keeping up with the cases that are being reported.
So how many people are currently working as contact tracers, and is there a plan to end those positions as of September 27th? Are those temporary positions that are going to stop?
Yeah, so our teams are continuing to trace every positive case, Madeline, and also individuals who've tested positive. And in fact, we are anticipating that we are going to be scaling up some of our case investigation to better respond to the current demand. Currently, we have about 1,330 case investigators and tracers, and they support anywhere between 1,500 to 2,000 cases a day. One of the things that we are not doing is that we are no longer calling every identified contact, and that is now the responsibility of the person who has tested positive. And we are focusing on investigating cases in high-risk settings, such as acute and continuing care.
Thank you. I apologize for my awful French, being from New Zealand, but Andrienne Williams, please.
Not bad at all, thank you. So my question, I have one question and one follow-up about the consequences that workers who would not agree to being immunized would face. Any idea on the steps that AHS could take?
Yeah, so as I said before, we believe that most of our healthcare workers will want to get vaccinated. Where a worker remains unvaccinated and has not been granted an exemption or an accommodation, we will be meeting with them. We are setting up a process where each of the cases will be reviewed, and we'll be meeting with the worker to discuss their concerns around vaccination and providing educational resources. And if after all of that, it may result in an unpaid leave of absence to allow for compliance and for them to consider vaccinations. So that's kind of the process. We're still working through some of it. Obviously, we do need to, as I say, engage stakeholders and our union colleagues about this, but we're confident that our healthcare workers will step up to this and get vaccinated.
And do you have an idea of how many workers still aren't vaccinated or fully vaccinated?
Well, that's one of our challenges, is that we actually don't have those full numbers. And what our policy will provide for us is an ability to actually collect that data. And so one of the first things that we do really need to do is to actually find out how many are vaccinated. In general, we believe that our uptake is above the public uptake of vaccinations. And obviously in certain areas, the uptake will be quite high. So we do believe that most of our healthcare workers are vaccinated already, but that there still are some percentage that we do need to work with in order to fulfill this new policy requirement.
Thank you.
Thank you. Kevin Nimick, please.
Hello, can you hear me okay?
And did you see that coming down
Yep,
there for
we're-
a gray sweater, white shirt?
Fantastic.
The clinic that we just shot.
Okay, so you mentioned just then a paid leave of absence for staff who refuse to get vaccinated after this process of education. Am I correct in understanding that? And why would it not be an unpaid leave of absence?
Yeah, sorry, Kevin, I might have been not clear. It is an unpaid leave of absence, not a paid leave of absence.
Okay, thank you. And you also mentioned a little earlier, employees who cannot be vaccinated on a medical basis will be reasonably accommodated.
Correct.
Can you be more specific about what that reasonable accommodation might look like? Let's say for a nurse who works at the Foothills Hospital.
Yeah, so that's still some work in progress, Kevin, but if I had to sort of just give you an example for, it might be working in sort of a virtual care environment where they don't have face-to-face contact, as an example. But at the end of the day, these will be dealt with on a case-by-case basis, fully understanding the need to have that understanding of what the accommodation is. And you obviously use our existing processes in place to help with that.
Thanks, Kevin. Let's go to Shane Clausing, please.
Hi there, can you guys hear me okay?
Yes, we can, thank you.
Perfect. A couple questions for you guys. On Friday, you guys came out and said you'd be canceling 45 surgeries per week at the QE2 hospital in Grand Prairie in order to make room for COVID-19 patients. Since then, there's been several people who've been transferred to other hospitals elsewhere. And now we've heard reports from people that it's actually more than 45 surgeries that are being canceled per week. Are you able to confirm if that's true?
Yeah, Shane, I'm going to pass that over to Braden, if that's all right. Dr. Mance?
Sure. So our percent positivity rate in the North Zone is around 26%. So they are feeling the brunt of this fourth wave of the pandemic there, and in a few of the other rural zones. They had a significant number of admissions late last week, and that resulted in the need to delay these 45 or to close an operating room, which impacted about 45 non-urgent surgeries per week. Over the weekend, they needed to transfer out about 9 patients to allow them to staff a COVID ward, which opened on Monday. And we do expect that they're going to need to delay some further non-urgent elective surgeries this week and in the coming weeks, as we expect will probably be the case in other zones, to make sure that we have those beds for patients who need them.
Just a quick follow-up on that then. So a lot of what we hear about the QE2 is about how it's kind of understaffed too, and it's not exactly the most up-to-date hospital. It's a very old hospital, as you guys I'm sure are aware of. In terms of just right now it's understaffed, it's a bad situation and it sounds like it's getting worse. There's a new hospital here opening up on December 4th. Is that going to be understaffed and in a similar state? And I guess, how does the situation get any better in terms of trying to get people up to Grand Prairie to work?
Well, maybe Shane, I'll start by saying that that's why it's really, really important for everyone to go out and get vaccinated. I just can't emphasize the importance of that, because it's really going to take everybody's effort to make sure that we bring this tide under control. The health system can only absorb so much. So it is really, really important that everybody, all Albertans, go out and get vaccinated and practice good, public health measures. So really at the end of the day, I would throw it back out there. We are on time, on target for the Grand Prairie opening. And so, who knows what will happen in December when we, start some of the transitioning. But just to say that we have to deal with this COVID, and the best way to do it is through vaccination. So please, everyone, please go out and get vaccinated.
Thank you. Bill Fortier, please.
Thank you. You can hear me okay?
Yep, you're good, Bill.
Okay. Just for starters, the decision on mandating these vaccines for healthcare workers, whose call is that? Is that the politicians that made that call? Is it you? Is it Dr. Hinshaw? Who made the decision?
Yeah, so this is Alberta Health Services policy. This is a decision that was made through our leadership team, myself and our executive leadership team, supported by the AHS board. This is not politically driven in any way. We did make Minister Chandra aware of our policy decision, but at the end of the day, this is an organizational decision because we felt it was very important to really keep Albertans safe. They are the most vulnerable in our acute care sites, and we are seeing outbreaks, especially amongst those who are unimmunized, both within the public as well as within our workers. And so, it really is the next step for us to ensure public safety.
And just a quick follow-up. Since this pandemic started, whenever there's been an announcement, it's been Dr. Hinshaw that has made it. Not that we don't appreciate you, Dr. Yiu, being here, but can you tell me why? Was Dr. Hinshaw not available today, or why are we not hearing from her today?
Yeah, well, I can't speak on behalf of Dr. Hinshaw, but as I mentioned, this is an Alberta Health Services policy decision. And Dr. Dina Hinshaw works for the Alberta government and not for Alberta Health Services. So, and we are not government, we are a Crown agency. And so this is our responsibility to own and not Dr. Hinshaw's.
Thanks, Bill. Let's go back to Madeline Smith, please.
Hi there, I have another slightly off-topic question about contact tracing and then hospital capacity as well. So are positive COVID cases still being sent out to test for variants? I know that the Delta variant is obviously dominant right now, and it seems that most of the tests would be that. But are we continuing to screen for additional variants of concern that might pop up here?
Yes, Madeline. So Alberta Precision Labs actually does do that. They do the sequencing for the viruses. In fact, APL has actually been leading on the leading edge of all the sequencing for the different viruses. So yes, that is happening.
Okay, and then in terms of hospital capacity, I'm not sure if someone else may have to address this, but have patients been getting transferred out of Edmonton and into Calgary hospitals due to capacity issues there? I've heard some sort of rumors swirling about that, but has anyone had to be transferred to Calgary due to issues sort of in the central or north parts of the province?
So Madeline, no, we have not had any transfers out of Edmonton to Calgary. The transfers have been primarily from the north zone to Edmonton so far.
Katherine Grakowski, please.
Hi, thanks for taking my question. I did have a question around how negotiations are going with the unions. You had mentioned that Alberta Health Services employees already require vaccines for things like measles and influenza, but has there been any resistance from some of the other unions for some of the other areas, or how are talks going? Is it cooperative?
Yeah, so obviously we can't, Katherine, we can't really talk about negotiations. We're in the midst of negotiations. All I can say is that we're very appreciative of our staff, and we are consulting with the unions on the policy.
And in terms of actually getting these vaccines in arms, I know in North Zone, it's been a lower uptake. Is there anything that you're going to be doing extra to ensure that all these staff and and volunteers get their doses on time?
Well, there's a lot of availability in terms of appointments. You can book online, you can book through your local pharmacies, you can go through HealthLink. It's the same day or the next day across the province right now. So there's a lot of availability for vaccination uptake. So that is not a barrier at all right now. We have got ample vaccines for people to take.
Thanks, Katherine. Andrea Williams again, please.
Yes, I just had a question about who is, who will need to get their vaccines. Is it only the people who work in hospitals or any AHS employees even working in offices?
Yeah, so Andrea, we've been actually wanting to include all AHS employees. So the decision when we were discussing the policy was to include everyone, regardless of where they work. We're doing this to preserve consistency and fairness as an employer, and also because we all directly or indirectly support AHS operations, and we all have a duty to preserve our healthcare system capacity.
Thank you.
Kevin Nimick, please.
The new vaccine requirement doesn't come into effect until October 31st. Why have you allowed for that long of a runway for people who are not vaccinated yet to get vaccinated?
Yeah, Kevin, so we did a bit of backwards tracing with that. If you think about it, let's say you were to get your first dose vaccination, don't forget you need a 4-week window for between your first and second dose. And then you need 14 days or 2 weeks after that for immunity. So part of it was related to just the timeline of getting fully vaccinated. But we also wanted to give ourselves some time to make sure that we're fully engaging with our stakeholders to make sure that we actually have that input in place. So really it was a combination of the timing of the vaccinations as well as the need for the engagement.
And a quick follow-up, I know you said a little earlier you don't have the overall percentage of staff that are vaccinated, but as I understand it, there was a voluntary program where staff could say whether they're vaccinated or not. Can you give some sense of the numbers, even if you have to break it down to a specific employment group?
Well, generally we do know that generally what I can say is that when you look at some of the literature, when they look at healthcare workers in general, they are probably have a higher rate of vaccination than the general public. And overall, maybe up to 10% or higher. So maybe use that statistic to add on to the numbers of the currently Albertans that are vaccinated. It's actually very difficult to actually know the exact vaccination rates of healthcare workers. And obviously we're targeting for as close to 100% as possible. Hope that helps.
Thanks, Kevin. We'll go to James Keller now.
Hi there. Sorry, so a quick follow-up on the vaccine mandate issue. Have you gotten a legal opinion on this? I know that the Premier and the Health Minister have suggested that this is illegal, and I'm just wondering why AHS has a different opinion, and if those public comments from the politicians might make this a bit trickier for you to implement.
Yeah, so thanks for that, James. We are very confident that the policy is legal. Obviously, in terms of the development of the policy, we had very strong legal input into it. We have an underlying obligation at the end of the day to provide both a safe workplace for our staff, but also a safe environment for patients and public. Yes, we have had legal review and feel that it is legal.
Do you have a follow-up, James?
No, I'm good. Thanks a lot.
All right, let's go to Justin Slim, please.
Hi, I'm just curious, has Alberta Health Services, or what kind of discussions have been happening in terms of the work from home policy? Is there any idea to get staff who are not needed with frontline care to work from home again?
Yeah, so that's a really good question. That's a little bit in evolution, and I think part of our challenge is, things seem to almost change if not on a daily basis, on a weekly basis. So, initially, we're looking at, return to work policy and what the dates were. And obviously now with everything changing, we're looking at, whether that date needs to be modified. I just want to assure everyone that we do have a strategy around return to work. And we're reassessing that regularly with the number of cases. We have been asking our staff who are able to do so to work from home since the beginning of the pandemic, and we are continuing to do so if possible for those staff.
Justin, do you have a follow-up?
Yeah, just to follow up in terms of booster shots, is that something that is being explored for the general population, or is it right now just to be immunocompromised Albertans?
Well, the booster shots are based on sort of national recommendations. That's really a government, Alberta Health, Dr. Hinshaw decision, and so I'll leave it with them to answer that question.
Thanks, Justin. And we'll take our final question from the esteemed Bill Fortier, please. Bill, you have your hand up.
Sorry, Carrie, I don't have another question. I just didn't take my hand down. Apologies.
Just waving at us for fun. That's fine. All right. I think we are just about out of time. So thanks everyone for participating in this call today. Really appreciate it, and have a good rest of the week. Thank you.